Alive and Well STL is a presentation of the St. Louis Regional Health Commission with the first decade review of health status report to build a healthier St. Louis, and RareGem Productions. Power up with the positive. Learn more at OneRareGem.com. That's OneRaregem.com.
Support for Alive and Well STL comes from Beyond Housing, helps entire communities become better places to live. Learn more at beyondhousing.org.
The Regional Health Commission works in partnership with regional health sector advocates and stakeholders to improve health care access, reduce health disparities, and improve health outcomes for the uninsured and the underinsured in St. Louis City and County.
Alive and Well STL with Bethany Johnson-Javois, CEO of the St. Louis Integrated Health Network.
This morning's topic, we're talking specifically about the Gateway to Better Health Demonstration Project.
Access, I think, is critical because that's the first step. If you don't have access, you can't begin to work to improve your health, particularly if you're already fighting a chronic condition. That's when it's most important to have that access to an ongoing physician relationship. And that's really what we're trying to accomplish with Gateway to Better Health, is to give people that access to a physician relationship. Our hope is that you can form that relationship with a physician to maintain good health so you don't end up in the hospital.
We'll be right back.
RareGem Productions, proudly presenting, promoting, and producing positive programs.
Angela and Jennifer, I'd like to ask you, as part of your introduction this morning, to talk about your definition of what it means to be alive and well in STL.
Thank you, Bethany. For me, it means letting our families and our children have hope for a better future, and particularly with healthcare, making sure that that's not an impediment for them in achieving that future.
Thanks, Bethany. For me, that means to operate, live, and be able to move as your best self within your community, to be healthy both mentally, physically, as well as spiritually.
Awesome. Thank you for sharing your definitions with me this morning.
Alive and Well STL.
Good morning, St. Louis. This is Bethany Johnson-Javois, CEO of the St. Louis Integrated Health Network, and I'm glad you're joining us today for another edition of Alive and Well STL, sponsored by the St. Louis Regional Health Commission. Today, I'm excited to welcome you, our listeners, and our guests from the St. Louis Regional Health Commission, Angela Fleming-Brown, Director of Operations of the Gateway Demonstration Project, and Jennifer Brinkmann, Chief of Staff. Thank you both for joining me today.
Thanks, Bethany.
Thank you.
And I know that both of you have been key leaders in helping to develop, design, and implement the demonstration project. So I'm happy to have you on the show. I guess to start off, if either of you would give us a little bit of context about the Regional Health Commission and why the commission was selected by the state to help lead and organize the Gateway to Better Health Demonstration Project.
The St. Louis Regional Health Commission was founded about 12 years ago to help improve access to health care in the St. Louis region. And it was formed in the wake of the closure of the last public hospital in St. Louis Regional Hospital. So over the last 12 years, we've worked hard through a number of avenues to improve access to health care. And part of that has been maintaining financing for some of the safety net providers in St. Louis. The latest version of that is called the Gateway to Better Health Demonstration. And in that demonstration, the federal government gave the state and the St. Louis region permission to continue funding those safety net providers, with the caveat that we implement a coverage model. And so today, many of your listeners probably have heard of the Gateway to Better Health program, which is a coverage model for adults in St. Louis City and County who use those safety net providers. So the St. Louis Regional Health Commission's been honored to be working in partnership with the state to implement that program for the region.
Angela, you were recognized in 2013 as the stellar performer in healthcare by the St. Louis American. And part of your long line of work with the Regional Health Commission is the Director of Operations. Talk a little bit about what you've learned from doing this work. What have been the challenges? What have been the triumphs about doing strategic planning?
I have been at the commission for over 6 years now and working through a lot, mostly working with people who need access to health insurance and trying to be able to transform systems in order to provide care in the best way as possible so that these patients are able to receive the quality of care as someone who does have insurance. Through this work, I think what has been successful as having this coverage model for Gateway to Better Health is that we've been able to provide access to care for people who otherwise did not have that access From this work, we have received, I think, a lot of letters and comments from patients who are very pleased with now that they have Gateway to Better Health, they're able to afford their medications, they're able to see their doctors, they're able to get access to those specialty care doctors that we think of as people, your heart doctors or your doctors that treat you for your diabetes, or as we call in our community, sugar. And they're able to get access to those services that they had not been had access to without this program. And so I think through that program, we've learned that once people do have insurance that's affordable in a way that they can access, that they do actually want this care, where we think that people who are poor, they're not actually trying to be healthy, they're not trying to live as their best selves, but once they do have access, that they are actually happy to have this service and very grateful that someone is trying to make sure they have health care.
What are the top 3 to 4 outcomes from this demonstration that now St. Louis is able to capture and to hopefully generalize to other states, other cities who are in similar health conditions as we are?
We're just beginning to learn sort of what the outcomes are from this. We do know that we've been able to provide a whole lot of access to health care, nearly 60,000 medical visits in the first year, access to medications. In terms of health outcomes, we have seen in some very small studies that patients, for example, who were struggling with controlling their hypertension prior to having Gateway coverage, once they did have Gateway coverage, they were able to control that hypertension. And then we're seeing, when we look at health outcomes in the health centers who are treating these patients, we are beginning to see improvements there. And I expect that we'll continue to see that over time. It's a bit early to know for certain what all those might be.
I think that the naming of this project is appropriate. Gateway, the definition means something that serves as a means of access. So, in your opinion, why is access so important? And is access the same as actually utilizing care?
Access, I think, is critical because that's the first step. If you don't have access, you can't begin to work to improve your health, particularly if you're already fighting a chronic condition. That's when it's most important to have that access to an ongoing physician relationship. And that's really what we're trying to accomplish with Gateway to Better Health, is to give people that access to a physician relationship. The program is not full health insurance, and so we can't pay for all services, particularly hospital inpatient services and things like that. But our hope is that you can form that relationship with a physician to maintain good health so you don't end up in the hospital.
Is access the same as using care? And how do we get people who now have an option into health centers to actually use that benefit?
So I think we found with people who meet this population who are uninsured is they have a lot of competing priorities in their lives, things that are not necessarily directed towards getting to a doctor and having health care. So to have access, I think, as Jennifer mentioned, is the first step in this process, that it's something that's affordable that they can actually get to once they need it. But there are, I think, once they actually moved toward more utilization, is that we do have to start looking at other things that affect people's lives, mental issues, things that are going on in their community, not having the right grocery stores or being able to provide those healthy things in order to get them to utilize that more, and getting out there to provide more education, I think, to this community is also another thing that needs to be done in order to help move us past getting the access to actually using the services that are available for us.
So let's start now talking about how we educate our community. What are the benefits of Gateway? How would someone that's interested know that they are eligible, and how do we get them into the program?
If someone is interested in applying for the Gateway to Better Health program, they should visit their local community health center. Some of those are like People's Health Center, Grace Hill Health Center, Family Care, one of the county Department of Health, and Early Hickory Davis, in order to apply for the program. And they have people there that are able to assist them. We also have a website for them if they want more information about this program. Our website is www.stlgbh.com. And a 1-800 number if people would like to call and talk to someone more about their options for applying. That number is 1-888-513-1417.
What are the general eligibility requirements for Gateway?
To be eligible for Gateway, first you have to be uninsured. You cannot be eligible for Medicaid or Medicare. We need you to be an uninsured adult between the ages of 19 to 64. You must live in St. Louis City or St. Louis County and be a U.S. citizen or legal immigrant.
Tell us about the future plans now that we've had success with the pilot. We now have an approval by CMS to allow us to continue. What's the time frame on that, and what happens next with the program?
So the Gateway to Better Health program was originally designed to be a bridge to coverage available through the Affordable Care Act. And I think as many people are aware, the state of Missouri hasn't completed building that bridge yet. Medicaid has not been expanded to cover adults up to 133% of the federal poverty level as designed by the Affordable Care Act. So because Missouri has not yet passed legislation to enable that expansion, the Gateway to Better Health program was approved to be extended through the end of 2014. So we're pleased that we're able to maintain access for patients to their community health centers, but remain hopeful that Missouri will in fact expand Medicaid so that full health care services are available to the patients we cover. The program could possibly be extended beyond 2014, but that remains a decision for the federal government, and we won't know that for some time. And the best option truly is for Medicaid to be expanded. That's better for the patients, it's better for our community. So again, we remain hopeful that we'll come to a resolution in our state about how to do that pretty quickly.
Since we're on a show that targets the faith community, pulling off Gateway demonstration project is nothing short of miraculous. And it puts St. Louis and Missouri on the map in a positive way that typically doesn't happen. Can you talk about what it takes to really pull off a region-wide, statewide collaboration of this magnitude in order to make this work for our community?
When we started to plan this program, the people who we brought to the table with us, many of them thought it couldn't be done, that it wasn't possible to pull this off. And yes, through lots of hard work and I think a lot of help along the way, we were able to do it. And I will say it was because of the collaboration from all of the stakeholders, including the healthcare providers in St. Louis who've worked with us to design this program, to be able to best serve patients with the limited budget that we have. The community health centers were critical in that, as well as the state of Missouri. The staff at the state of Missouri have been incredibly supportive of our efforts to help make this a reality, and it wouldn't be possible without them. So we've had, I would say, an amazing level of collaboration across the community to help get us to where we are today. And there's room for improvement, and we'll continue to work on that. But again, we're very grateful for everyone who helped us get here.
Angela, you take a lot of the phone calls of patients who need additional assistance. What is your typical call, and how do you resolve those issues?
A typical call for the Gateway program is usually a patient who is confused about their benefits or confused about who to call in order to get access to care. And it's mostly around educating them about what Gateway actually covers, who their provider is, and how do they call in order to schedule an appointment. And it's a lot of helping the patient, sort of facilitating that relationship with the health center in order to get patients connected and into care.
Which is the role of the Regional Health Commission and its mission. That's outstanding. Well, in closing, I want to ask both of you a question. Each show, we try to leave our audience with something actionable. So use your space to either talk about a myth or a misconception that perhaps we can clear up. Or is there one step that you think an individual, particularly hearing they may qualify for this benefit, can take today to make their lives better and stronger for their family, their community?
I think the most obvious action is to go sign up. If you qualify, you will have access to very low-cost medical visits and medications. And we have gotten to know some patients where this has made a significant difference in their lives. It's the difference of them being able to work or not work. It's a difference of them being better caretakers for their families. And so just taking the action to go sign up, learn about it, and then get involved in your health center where you can access the health care to help improve your life.
So I would, as far as the action item, I will agree with Jennifer that the first step for someone to do is to go into a local health center today to find out more about the program and to enroll. One of the biggest misconceptions I think we find about this program is that it's not insurance. But it is a program that if you have no other options, that does provide access to care, and you are able to get health care, you are able to see a doctor and get those medications. Other than that, just go in today and apply.
St. Louis, prevention and early intervention is so important. So take this opportunity to support your own future and see if you qualify. And if so, take the necessary next steps to make it happen. I'd like to thank both of you for joining us this morning. It's been a pleasure to work with you for at least over 5 years, Angela, and forever, it seems like, Jennifer. Thank you for the work you do and for the Regional Health Commission's support and advocacy in this realm.
Thank you, Bethany.
Thank you.
Pleasure to be here today.
Alive and Well STL. Thank you for joining us today. For resources available, go to aliveandwellstl.com. If you have more questions about the program, need help, or want to connect, please call the message box at 314-333-8369. The Regional Health Commission with Chief Executive Officer Robert Friend Jr. committed to providing a detailed review of change over the past decade in 14 leading health indicators for the city and county of St. Louis. The first decade review of health status report, an update to building a healthier St. Louis. Discover the narrative, the data, and celebrate the progress already made to improve healthcare access and reduce health disparities in our region. Learn more at stlrhc.org. Alive and Well STL is another positive production of RareGem Productions. Thanks for listening.